Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas with Bill Kearney of Northlake Medical Pharmacies. Bill, welcome. We're doing a pre-recorded show today.
Yes, we are, but I gave you a little hint about what the first thing was we were going to talk about this morning. Do you remember?
It was the medicine that we talked about last week that had the canakinumab. Canakinumab, there we go.
And the reason that we wanted to talk about it was that, you know, I try to get this on the air as soon as I hear about something like this, and it was on it was either on 60 Minutes or on the show on Sunday morning about this new drug, anti-inflammatory drug that could reduce your risk of a heart attack. And I felt pretty good about that because we talked about it on Wednesday, and it wasn't until Sunday that it came out on the national news. And to kind of renew, we kind of started on this, and then all of a sudden the show was over. But more than 700,000 Americans will suffer a heart attack this year, and 1 in 4 of them will die. Thankfully, a trial of this drug, which is an anti-inflammatory medication, indicates that soon those numbers could fall dramatically. Very expensive medication. We have known in the past that anti-inflammatories could help prevent sudden death attacks, and we talked several times about atorvastatin, which is Lipitor, at being an anti-inflammatory that would, we briefly mentioned last week, if you look through a blood vessel, you could see it would appear to be clear, but on top of that blood vessel, there would be an aneurysm or a bubble. That bubble would burst, and the people would die of sudden death. So these researchers recruited 10,000 people across 40 countries and assigned them to several groups, and the final study that was published in the New England Journal of Medicine on last Wednesday reported that 150 milligram dose reduced the risk of a repeat heart attack among patients by 15%. And that's the first time that they've been able to definitely show that lowering inflammation, independent of cholesterol, this is if you don't have a cholesterol problem, would work if you did have a cholesterol problem, but even if you didn't have, it has far-reaching indications. So not all the data is good. They reported the recipients of the drug had an increased risk of potentially fatal infections. We mentioned this before, that it reduces their immunization ability, their ability to fight off infections. That prompted other people to caution against the regular use of anti-inflammatories until further research is conducted. So luckily there are other ways to reduce your heart attack, and we know what most of those are, and it's diet and exercise, and keep from having a heart attack. But we wanted to mention this because it had hit the national news and didn't get really into the national spotlight until last weekend, and we had talked about it on that Wednesday before. So I had reminded you, Paul, that as we closed the show yesterday, that if you could remember the name of that drug, and you kind of mumbled your way through it, but at least you had some indication of what we were talking about.
At one point, I'd written it down, and I still, if you ask me what it is right now, canakinumab or
canakinumab.
Canakinumab. There you go.
So anyway, I'll probably be asking.
Doesn't it have a flashy name? Are they going to come out with some sort of Celebrex? Or?
Yeah, the other name is where is it? It's on my other sheet here. Elara, or let's see here. The final study. Ilaris, I-L-A-R-I-S.
Ilaris,
you can try to remember that one, because
anti-inflammatory
I-L-R-I-S. A little more current news that happened last week, and there was an article on the internet that kind of stemmed my interest, and it was about a boy who had almost died by eating a hot dog. And after taking, and I thought, well, how could a hot dog cause you other than choking? But after taking a bite out of a hot dog, a 9-year-old boy went into cardiac arrest. But according to the case study published in the Journal of Pediatric, it wasn't because he was choking. that was just published on yesterday and detailed an incident in which a particularly large bite of a hot dog triggered the boy's vagus nerve, which is a nerve that helps the heart function, and it stimulated an abnormal heart rhythm that resulted in cardiac arrest. The boy fainted, was defibrillated and resuscitated, and when help arrived, he was sent to an ICU in Istanbul due to suspicious heart rhythm readings. And the researchers explained the boy was taken to a hospital where tests found that he was suffering from Brugada syndrome. Never heard of this. It's a rare but potentially fatal heart rhythm condition. Brugada syndrome is difficult to diagnose, according to the Stanford Center for Inherited Cardiovascular Disease, because many people don't suffer from any symptoms until they have an episode. And you can imagine at 9 years old, this boy had never had any kind of abnormal heart rhythm, had never had any cardiovascular problems at all. And until they have an episode like this, no one knows about it, and usually it's fatal. Because it's difficult to measure statistics, for that reason, Stanford estimates that about 4 out of every 1,000 people in the United States have been diagnosed. The biggest danger is that it can cause the heart to develop dangerous, irregular rhythms that can lead to sudden death. And this gentleman, or this 9-year-old, was extremely lucky that they found out what it was and treated it. There's currently no cure. Doctors can put in place an implantable cardiac defibrillator that helps eliminate the risk of death if another episode occurs. And we don't know how often that might occur because we have such few statistics. But the boy referred to in this case study had one implanted to prevent further sudden cardiac arrest. The condition is genetic. Doctors brought the boy's family in for testing, and they were able to diagnose his brother with Brugada syndrome before an episode occurred. So here we are. I saw that and I thought, was there a poison in the hot dog? I wondered what could happen. How could a boy die from one, or almost die from one bite of a hot dog? And it was because of this Brugada syndrome, which was a rare but usually fatal heart rhythm condition. They caught him soon enough to put a defibrillator in and get him back in shape, and now he's not like brand new, I'm sure. This is a hard, traumatic thing for a boy of 9 years old, and to have to live with that, whether he has to taper his athletic possibilities of going on in the future, whether he was an athletic type person or not. We don't know much about it because he was from Istanbul, but there are a lot of other things that go with this, as well as probably what he experienced at sudden death. It would be interesting to talk to him about if he remembers anything he went through at that time. A new article this morning about diagnosing cancer in 10 seconds. When it comes to treating cancer, one of our problems in treating cancer is we have to treat so much healthy tissue as well as diseased tissue, and they want to get rid of as much cancerous tissue as possible during the time they're taking a tumor out. But many times we take a lot of healthy tissue out because we don't know how far the cancer has progressed. And in attempting to make that easier by distinguishing between tumors and healthy tissue in just 10 seconds, this is called the mass spec pin. It's a real-time diagnostic tool created by the researchers at the University of Texas at Austin in a new study that was just published Wednesday in the Science Translational Medication Journal. Their handheld device, which is not yet FDA approved, uses tiny droplets of water to analyze human tissue, and it does it with 96% accuracy. It's a gentle, simple chemical process. It's highly specific and highly sensitive. The fact that it's non-destructive brings a new approach to cancer diagnosis. Getting rid of all cancerous tissues while also preventing any harm to healthy tissues is really a difficult process and very delicate, and we have worked with this for years and years and years. even to the point that when we're treating cancer tumors, we're trying to get more specific about the exact spot the cancer is. Many times it's just spots on the liver or the kidney or the lungs, and you don't have to remove the whole organ in order to treat the tissue. But you want to be able to zero in as close as you can on that tissue without hurting healthy cells. When operating on a woman with breast cancer, for example, a doctor needs to remove the tumor and other affected tissues while maintaining the rest of the breast. And of course, that's a very difficult process. Breast tissue is fairly large. There are currently tools available to surgeons for tissue diagnosis, but it uses gases or solvents that could be harmful for the body. And in 2016, they developed a probe that can find and light up cancer cells, making them easier for surgeons to see. But, you know, other methods are currently available today that are slower than the mass spec pen. And it takes about 30 minutes or so and can damage some human cells as well. There are human cells that produce a small molecule, and cancer creates a unique set of them that can be used for identification of the pattern. But this mass spec pen produces a small drop of water that takes out molecules from a person's cells during surgery. And through machine learning, the mass spec pen is able to determine what the molecular or the cell fingerprint is, what is normal and what is cancer. This isn't a huge study, and you know that I'm partial to big studies, but it's not a tiny study either. They tested 253 human tissue samples from the lung, the ovary, the thyroid, and breast cancer tumors and compared them with samples of healthy tissue. Was 96% accurate identifying cancerous tissues. They also tested the MAC spec pen in live mice with tumors and found the device was able to identify the cancer cells without harming any healthy surrounding tissues. It can also identify different subtypes of lung and thyroid cancer, as the team hopes to make it more specified for other types of cancer too. They need to continue validating their work, and that they plan on start clinical testing in humans next year. Until then, it's unclear how exactly the device will work when integrated into surgery. While we know that the pen-sized device we would use is small, it's connected to a large mass spectrometer which measures the waves and the amount of tissue, and helps the process of actually finding out which individual molecules are involved. The device would have to be wheeled in and out of a surgery room for each procedure. The pen is disposable, so surgeons would replace it with each surgery. It's a good example of a tool that empowers our transition to precision medicine, where treatment can be done with much higher levels of confidence. You know, we've been battling this disease for as long as I can remember. My grandparents died of gastrointestinal cancer 3 months apart before I was even born, and I was born in 1942. The amount of cancer that was diagnosed or specified in those early ages was not huge. You didn't hear of that many people getting cancer. Now, with the diagnostic tools we have, as well as tools like this to help from destroying healthy tissue, it is becoming, it seems like there's more and more cancer. There really, I don't think, is a whole lot more cancer. There's a whole lot more of finding out that something is cancer that we thought was another disease-oriented type of disease that would cause major things to take place, where if we had treated it for cancer early, we probably could save people's lives. There was an article out actually in People magazine this past week that talked about a cold medicine that was taken by a North Carolina man accused of stabbing his wife, And they're saying that the cough syrup that he took caused hallucinations when he took too much of it. Now, this was an aspiring pastor that was accused of fatally stabbing his wife in the middle of the night, and taking this medication in high concentrations that are similar to those caused by PCP, which is a street drug that they used as an animal tranquilizer at one time, and they found out that you could hallucinate and lose your mind by taking it with a needle or snorting it. But according to a New York-based forensic toxicologist, the cold medicine Coricidin contained both dextromethorphan and chlorpheniramine. When abused recreational, the cold medicine can cause euphoria or being excitable, agitation, psychoses, or dissociative phenomena. Now, we know in the past that guaifenesin with dextromethorphan can cause kids to hallucinate or people to hallucinate, and they would drink a whole bottle of cough syrup that had dextromethorphan in it. And chlorpheniramine is the old antihistamine that was called chlortrimeton. We still sell it over the counter in tablet form and liquid form. But dextromethorphan is an anesthetic that is designed to be an anesthetic and can cause out-of-body experiences, and one can lose their ability to sense pain. Chlorpheniramine is a cough suppressant as well as the dextromethorphan, and that particular drug is abused, and the reason it's abused is if you take high levels of it, the drug properties are similar to PCP. That's phencyclidine, and that was huge even in the 70s when I lived in the Bay Area. People were, police officers were incarcerating people or arresting people that were on high doses of PCP, and they would develop a strength that would take 4 or 5 officers to subdue, opposed to when they hadn't taken the drug. And one officer could take care of them. So it was known as angel dust. It's conceivable that someone who had taken a large dose could have experienced hallucinations and exhibited behavior that we consider outside of the normal. Matthew Phelps, he was 28 years old, called 911 on a Friday morning and said his wife of less than 1 year was dead on the bedroom floor, covered with blood. He said, "I had a dream, and then I turned on the lights, and she's dead on the floor." He said, "I have blood all over me, and there's a bloody knife on the bed, and I think I did it. I can't believe this." He said, "I took more medicine than I should have. I took Coricidin cough and cold because I know it can make you feel good, and a lot of times I can't sleep at night, so I took some." He has no memory of allegedly stabbing his wife. He was studying to be a pastor. He's charged with murder and being held at the Wake County Detention Center without bail. He appeared on court on Tuesday alongside his attorney, who said there's a lot to this story, and I believe that will be told in the future. There have been cases where these drugs have been abused over the counter, and there have been issues. We've seen people with PCP commit murder, violent behavior. So we don't know where this is all going, but they expect an expert witness would say that cold medicine could be a viable court defense. Bayer, who's the company that makes Coricidin, cough and cold, said they extend their deepest sympathies to this family. Reportedly, patient safety is our top priority, and we continue to monitor adverse effects regarding all of our products. There's no evidence to suggest that Coricidin is associated with violent behavior. But what do we do when we find out the Coricidin and the ingredients in Coricidin are metabolized into phencyclidine and then and dextromethorphan, and we have a hallucinogenic drug and an anesthetic drug that, if you isolate those two drugs, they can simulate those kind of problems. So here we have a cold medicine taken by a aspiring pastor that thought he was taking the right thing didn't have a prescription medication, was taking an over-the-counter medication. It didn't work for the first dose, so he took a second. We don't know the size of those doses, which will probably be revealed in a court hearing, and we'll find out what kind of a defense that the gentleman has for stabbing his wife. He did call 911. He did say that he probably did it, but doesn't really know. So it's just the reason I'm kind of talking about this is because the danger of over-the-counter medications can be if you abuse them. Not only just proprietary drugs like Coricidin and NyQuil and NyQuil Z, or Z is diphenhydramine, Benadryl. You drink a whole bottle of that and you probably don't wake up. It's no different than taking a bottle of pills if you overdose, even though they're over-the-counter medication. So there are key warnings on whether or not you should be taking these drugs and especially abusing them. And what we're trying to show you here is that it's just as dangerous to take an over-the-counter medication in excess as it is for taking prescription medications for excess. And we see plenty of that. And we're going to take a break. When we come back, we're going to talk about prescription drug abuse. I know you get tired of hearing about this, but there's a lot of obligation that goes onto you to keep this from happening, and I'll give you some statistics. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. Do you take non-prescription medications to relieve your headache, fever, or arthritis? If so, you're not alone. Americans consume more than 50 billion non-prescription over-the-counter medications each year. When taken as directed, they are safe and effective, but they're still serious medications. At Northlake Medical Pharmacy, our pharmacists want you to know they are always available to talk to you about your medications, including over-the-counter medications. So talk to our pharmacists for your good health. We also want you to know that we care about your health. By working together with our pharmacists, you can get the most out of the medications that help make you feel better when you're sick or help keep you healthy. So remember, talk to our pharmacists for your good health. Northlake Medical Pharmacies, with 2 locations to serve you, on Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops Mart at 347 Lakeport Boulevard.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, September 1st. No planned work from the 1st through the 4th due to the holiday weekend, but crews, of course, will respond to emergencies. In Lake County on Route 20 near Stokes Court, expect 5-minute delays weekdays. On Route 29 from Hofacker Lane to Martin Street, expect 5 and 10-minute delays weekdays. And on 175 near Arroyo Vista Road, expect 5-minute delays weekdays. In Mendocino County on Route 1, expect weekday delays in multiple locations. On Route 20 west of Chamberlain Creek, expect 10-minute delays weekdays. On Highway 101, expect weekday delays in multiple locations from Crawford Creek to Confusion Hill. On 175 near the Lake County line, expect 30-minute delays. And on 253 near Singley Cattle Pass, expect 15-minute delays weekdays. That wraps up the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways. Like us on Facebook for more updates and info on the type of work we're doing. That's Caltrans, District 1.
The Lake County Library presents the NEA Big Read during the month of October. Stop into your local library branch to pick up your copy of the novel selection Station 11. Then plan to attend all the events happening around Lake County. There's book discussions, forgotten skills demonstrations, thrift store, fashion shows, and more. For more information, visit the Big Read website at lakecountybigread.com or call the library at 263-8817. The NEA Big Read is a program of the National Endowment for the Arts in partnership with Arts Midwest.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month Business Design Services. Robert Bocabella, BFA, is principal and founder of Business Design Services and is a certified interior designer in private practice for over 30 years. He provides designing to fit the vision in collaboration with writing service at earthlink.net. To contact him, call 263-7073 or email him at rb@businessdesignservices.com or visit his website at businessdesignservices.com or on Facebook at Business Design Services.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back.
Well, prescription drug abuse, and one of the reasons that I wanted to talk about it, I was on the internet yesterday looking at statistics for opiates, and it showed the number of deaths from opiates by county in California. Lake County was the worst county in the state of California for deaths per 100,000 people. And I was shocked. And then a friend of mine was out at the emergency room last night, and he'd had a broken bone, and they were talking to him about drug abuse in Lake County and not being able to prescribe opiates, and how dangerous the problem is. And it is the use of a prescription medication in the way not usually intended by the doctor, but it's also problematic because people will take friends' prescription painkillers for their backache, or snorting or injecting ground-up pills to get high, and it's the abuse may be becoming ongoing and compulsive despite the negative consequences. And if you think I'm talking to the choir, you definitely have somebody in your family, whether you know it or not, whether it's your direct family or down a generation or so, but it's an increasing prescription drug abuse that can affect all age groups. It's more common in young people. Most often now it's been in white people more than people of different colors, but the prescription drugs most abused include opiate painkillers, sedatives, anti-anxiety medications, and stimulants. You're familiar with Norco, I'm sure, OxyContin, hydrocodone. Those are the opioids. Anti-anxiety medications such as Xanax or Valium, and Zolpidem, which is Ambien. Stimulants, which kids that have ADHD, methylphenidate, which is Ritalin, Concerta, Adderall, Dexedrine. Those are all drugs of abuse. The danger here is on ADHD medications like Adderall and amphetamines that actually do a good job of helping young people focus when they're in school, become highly sought after by classmates and people that know better. And sometimes these kids have to take these medications to school. If they do, most of them are required to let the nurse know or whoever's there to take care of the medication. But many people don't do that. And then they end up selling them or giving them away, or they're being stolen. There's all kinds of side effects from opiates and sedatives and stimulants. The opiates, I just had somebody come in yesterday and they were legitimate. They had a prescription for a pain medication, and the patient was already constipated. And now the physician had given her an opiate to control her pain on an as-needed basis, and she hadn't had a bowel movement for a few days, and so she was already constipated, and this drug was going to make her even more constipated. And so we worked on getting a stool stimulant as well as a stool softener. and hopefully that would take care of that problem. And there's taking a real opiate medication by prescription for a necessary reason, and already having side effects. Nausea is another one. One of the reasons that people take these is they get a high from it. But the difficulty is later on they don't get a high. They just think they could feel worse if they didn't take it, and it's really not doing any good. It slows down your respiration, your breathing rate. Many times people who have a terminal illness or on morphine, that also slows down the breathing, although they may also have a respiratory problem from their cancer or whatever dose it is. Being confused, poor coordination. You can imagine driving like some of these people do. You will see an increased risk, whether or not you marijuana users want to hear this or not. You will see an increased arrest for people that are in accidents because of smoking marijuana. With sedatives, it's more drowsiness and confusion and walking unsteady, slurred speech, poor concentration, dizziness, problems with memory, slowed breathing. These are central nervous system depressants, are anxiety medications. So they slow everything down. We can tell when you call in a prescription if you're over-medicating yourself on an anxiety medication or have had too much alcohol. We can tell immediately. We can hardly understand some of you people that are calling for a refill on a prescription that's making you worse. Stimulants, like the amphetamines we're talking about, is a reduced appetite. A lot of people, these are stimulants now, so you get agitation and anxiety, a higher body temperature, not being able to sleep. Typically people who take amphetamines and are addicted to amphetamines have a hard time coming down from them. When they do come down from them, they get, it's like dropping them on a cliff. You're extremely depressed. You're no longer operating at that level you were before. You probably have an irregular heartbeat, could have some paranoia. Other signs of people that are abusing things, stealing, forging, or selling prescriptions, we see a lot of this in the pharmacy. Believe it or not, at least once a month we get a prescription that's been forged, and we let the doctor know. In the early days when we only had the Hill Road store, I used to come in at night on call, and people would have stolen prescription blanks. At that time you had to have what we call Schedule II blanks, and they were triplicates, and they would steal them from doctors' offices and then sign their name to the prescription. People are usually taking higher doses than needed. They will have excessive mood swings from taking their medication in the morning, whether it was legal or not legal, and as it tapers off in the afternoon and evening, more anxiety, more confusion, mood swings, over-sedating. They would have excessive increases in sleep time. Pretty hard to make decisions when they wake up in the morning and they've taken too many sleeping pills, excuse me, or anti-anxiety medications. Getting behind the wheel, they're likely to make a mistake, turn in front of traffic or run a red light or a stop sign. When somebody is really hopped up on a stimulant medication, be it cocaine, amphetamines, whatever, they appear to be high, usually energetic, revved up, hardly will stop talking. They're also the people that come in, and believe it or not, when they lose prescriptions, they seldom lose their anxiety medications or their pain medications or something that is relevant to them being addicted. They also, whenever they get their cars broken into, it's always the Vicodin, the Norco, the amphetamine, the Valium, the Xanax. Those are always the ones that people lose or get stolen. And then they doctor shop. So they go from doctor to doctor, and we are forced by federal law and state law to use the cure system to bring up anybody we don't know and put it in the Department of Justice website and check and see where these people have gotten prescriptions from other people, other physicians. And then we call both sets of physicians and let them know. We had one last week where they had gone to a dentist and they got 30 of the medication for a dental extraction or a root canal that they had already received 120 of from their regular physician. So we called the dental physician and dentist and said, do you want this person to have it? They're getting this from 2 different sources. The dentist said absolutely not, and we called the regular physician and told them that they were seeking another source. It may or may not have been intentional. When we told the individual and they came in to get their prescription, they took it back and went to go get it someplace else. There's several reasons that people abuse these prescriptions, and I guess the number one is to get high, to relax or relieve tension. The amphetamines were normally bought on the market for people to lose weight. They got into the system for people that wanted to stay awake and increase their alertness, like over-the-road truck drivers, and they had what they called white crosses, which were a type of methadone, which was a form of methamphetamine. They take them to keep from going into withdrawal. It's amazing how many people we have been taking off opiates because of forcing by the insurance companies and the PBMs that have gone through withdrawal and not had that much of a problem. So, in fact, many of them feel better. Most people fear they may become addicted to medications prescribed for medical conditions. It used to be, I mean, I've had, 4 back surgeries. Every one of those, I've been prescribed an opiate when I went home and was able to go back and get an additional prescription. And I probably only needed it for 4 or 5 days if I needed it that much. But the fear of that pain being back is enough to keep you wanting to take the medication. And risk factors now include past or present addictions. And I think about the number of athletes that are addicted to these kind of medications. And many, many times they get exposed to these medications when they're in high school and they have a football or baseball or a basketball injury, and they get on the medications and they're able to perform. And they don't think about the thought that these could be addicting, and now it's become an opiate epidemic. So the younger age, especially teens, early 20s, these are drug-seeking years. Pre-existing psychiatric conditions could be a reason. Peer pressure certainly is a reason. Easier access to prescription drugs as having them in their home medicine cabinet. Always look at your medicine cabinet. I don't have anybody in my immediate family that I think would take any medications that I'm taking, but anytime that I have people staying over or living in other quarters in my house, I never have those medications out where, not that I don't happen to be taking any pain medications or anxiety medications, but you never know what people will think. They may just take everything that you have there. So prescription drug abuse in older adults is also a growing problem when they combine drugs with alcohol. That's a huge problem in Lake County. Having multiple health problems and taking multiple drugs can put seniors at risk for misusing drugs. I had a patient the other day that was having pain and was taking 1 opiate a day at bedtime. The physician offered her methadone to take up to 5 tablets a day for the pain. The patient refused that and said, this isn't anything that I can't overcome. It may be a factor that will be with me the rest of my life, but it's certainly not worth being addicted to. Now, in terminal cases, that's certainly understandable if you take the medication. And there aren't really serious consequences legally if you're terminal and taking these medications in order to sustain some quality of life. Opiates can cause low blood pressure and slowed breathing, as we've said. Over medication of sedatives would cause memory problems. An overdose can cause coma or death. Stimulants, aggressive paranoia. One of the things that's happening today is fentanyl, which was designed as a patch called Duragesic to last 72 hours. Now they're making it in a capsule or a tablet form and combining heroin with it, and people are dying rapidly of fentanyl abuse. Many of them aren't physically dependent because all it takes is one dose of the wrong stuff to kill them. And if they continue to engage in risky behaviors or poor judgment, or because of the cost of opiates now and the federal government cracking down, and the FDA may prevent manufacture of opiates at all, people are going and getting them in street drugs. Primary care doctors will very seldom prescribe it anymore. When you go to a doctor, whether it's opiates or other kind of medications, you need to take all the medications that you're taking. Sutter Health is doing a brown bag review on October the 14th. I think it's the 14th. It's on a Saturday, and I will be out of town, but one of my pharmacists will be there, if not two, and technicians, and help Sutter and their pharmacists do brown bag examinations. And I offer that in my pharmacy all the time when I'm there. You bring in all the medications you're taking, whether you're getting them from us or another pharmacy. I will go through them all with you, as they will on October 14th at Sutter. They will determine what you're taking and what you're taking them for, and how, if you're still supposed to be taking them, including over-the-counter drugs and herbs and supplements, any symptoms that you might be experiencing, and questions like that that you should really be asking your doctor when you're being prescribed these medications. What are your options? Is it only the medication? How long am I supposed to be taking it? Should I be seeing someone for as a specialist? My wife, in her case, we've been trying to determine for 2 or 3 years what was causing her to have problems falling. And we were able to go to CPMC as a reference from our physician and see an ALS doctor and find out a diagnosis for why she was experiencing those falls. And we've tried to make provisions to treat that progressive disease. You might want to, if the doctor is ordering opiates or anxiety medications, is there any other things that you can take instead of those? And you may ask the doctor what prescription medications and how often you should take them, how long that you've had this problem, what, if anything, prompted it, how severe are your symptoms. I remember when I was diagnosed with colorectal cancer in 2003, I said to the doctor, what could possibly cause this condition? And it was missed the first time around, and he said, we really don't know. And he said beer is one thing, and I drink very little beer, and of course processed foods. And I have a weakness for sausages and those kind of things, and that might have done it. I continued to have a colonoscopy every 60 days to the point that I was growing little tumors in there that were tags that had to be cut out, and I got to the point where I wasn't even taking an anesthetic when I'd go in to have a colonoscopy. So I said, just cut them out, and I didn't want to lose a half day of work every time I had a colonoscopy, which was frequent. And so far we've been successful. And doctors generally base a diagnosis of prescription drug abuse on medical history in the physicians that I've talked to. over 50% of their time in the past was taken up with them determining whether or not you should be on an opiate or not. Those tests can help track the progress of a person who's getting treatment. If you, in fact, are addicted, there is opiate withdrawal, which involves tapering and gradually decreasing the dose until it's no longer used. Very successful in doing this. Not that it's a pleasant experience, but drugs such as clonidine, which is Catapress, may be used for high blood pressure, can be used to manage opiate withdrawal. Buprenorphine, which is with naloxone, which is called Suboxone, may be used and is used frequently, especially on opiates. Withdrawal from sedatives or anti-anxiety medications are tougher than getting off a pain medication. So if you're on Ativan or Xanax or alprazolam, which is Xanax, it can take longer for you to adjust your body to low doses of that medication than it could be on the pain medication. So there are over-the-counter drugs, especially herbal things, that can be used to bring you down from the sedatives. But many times we have doctors withdrawing people from the opiates, and then all of a sudden they're not refilling their Xanax or Ativan anymore, and they never cautioned them about not being able to get those drugs. It can take as much as 3 years to get off one of those medications if you're not really determined to do it and you do it gradually. Stimulant withdrawal, those amphetamines, there aren't any approved drugs used for treating the withdrawal. It typically focuses on tapering off the medications, such as sleep, appetite, and mood disturbances do occur. It can be very challenging and stressful, and I'm telling you, you have trusted friends or family members that are involved with this. Your doctor may be able to recommend sources. There's self-health groups such as a 12-step program, your church or faith group, your school counselor or nurse. You may be embarrassed to ask for help or afraid that your family members will be angry or judgmental. Look, we're all human beings. We're all treated differently. We all have different responses. You don't know what my pain level is on a daily basis. You could have the exact same condition as I do and not be able to tolerate pain as well as I do. And it'd be a serious thing, both physically and mentally. So it could be difficult to approach your loved ones about prescription drug abuse. I've had several people in the community come to me about a member in their family and what they could do and what they should do. Denial and anger are really common reactions. If believe me, this is close to you, and you may know it and you may not. But you have to be understanding and patient and let the person know that you care about his or her well-being. Encourage the person to be honest about drug abuse. They may or may not be getting it from a legal source, which just escalates the problem of what they're really getting. It's challenging to help a loved one struggle with drug problems and destructive behavior, but people who struggle with that behavior are often in denial or unwilling to seek treatment. Many times you have to do an intervention, which they're not always willing to do. Sometimes it has to be a dangerous one. And it doesn't have to be an opiate or an anxiety medication. It could be something else. There could be another condition that's causing them to act that way, and which an intervention is possible, and I've had to do that. In teens, you need to discuss the danger. Emphasize that just because drugs are prescribed from a doctor doesn't mean that they're safe. I think today most doctors are going through the educational process with the people that they're prescribing for. You need to set rules and let your teen know that it's not okay to share the medication with others. Not only teens, you people listening out there are guilty of the same thing. And I'm not saying that people in my family haven't done the same thing. It's over a weekend and they're out of an antibiotic or they're out of a pain medication, and so you give it to them. it's just not safe for anybody else to be taking your medication. You don't know if they have an allergy to the medication. You don't know if it could be a problem for them as far as having a reaction with other medications they're taking. You need to discuss the dangers of doing this. Even alcohol. Using alcohol with medications can increase the risk of an accidental overdose and keep your prescription safe. I hope I didn't over talk this thing because it is such a problem, and it's something that we have to address in a more aggressive care opportunity than we're doing right now. The laws are going to get stricter. Several states only will give a 7-day supply. Several insurance companies will only give a 3-day supply. These are going to be more difficult and more difficult to accomplish getting people to stop taking these drugs. A lot of people put this blame on pharmacists and physicians, and that was because a law that was passed several years ago that said pain needs to be treated. And they put pain as the 5th sign for you to, vital sign for the nurses to take. And that's why you have that chart in the hospital that says, give us a degree of pain, and has a smiley face on what you're going to feel like, a 1 or a 9. And if you want opiates, you say a 9 or a 10. And I have people that say I automatically don't do anything less than a 9 so I can make sure I get another dose of medication because I don't want to hurt. And they have real reasons for asking for that. It isn't just a substantial thing that I just want to accumulate opiates. It's these are in the hospital. These are IV doses or IM doses, and you don't want to hurt. You've already had surgery. You've had some kind of condition, and you don't want to get worse, and so you do that. One last thing on a drug that has had a new warning come out. The drug is Keytruda. It's used for many different diseases. Currently, it's indicated for melanoma, lung cancer, head and neck cancer, Hodgkin's lymphoma, urethral carcinoma, and instability cancer. And last year alone, it's received 6 separate approvals. One thing it has not been approved for is multiple myeloma. In a trial of 249 patients, there were 29 deaths of patients using Keytruda, compared with 21 in the control group of 50% greater risk of death. The response rate was 34% for those taking Keytruda, compared to 40% in the control group. So there is a warning for this drug not to be used for multiple myeloma until it can be approved for such because of the multiple deaths that have occurred. Again, it has 6 different diagnoses that are treatable with this drug, and that is not jeopardizing any of those. It's that same thing that we've talked about many times through the years of drugs not being approved by the FDA for the use that they're being prescribed for. Most of those drugs have been on the market for a long time, and we're taking chances. This drug has a huge risk even if you're taking it under the approved diagnosis. So we want to make sure that you're aware of that. And I get many calls recently about flu vaccines. We talked a little bit last week about children being vaccinated with flu vaccines, and that we're going to have the quadrivalent vaccine available at the Bruno's location, and the trivalent and the quadrivalent at the Hill Road location. I've had people coming in and asking to get their flu shots because some of our competitors are giving flu shots now. We will not get ours in for a week or two, and we would suggest not getting the flu shot before October. The problem is the potency of that immunization or that vaccine wears out about March or early April. And if you get it too early, the effectiveness of the vaccine is diminishing by the time the flu vaccine actually hits really hard, which is usually February and March and the first part of April. So we will let you know when we get the vaccine in. We know that people are urging to get it, especially the people that have gotten it for many years. Most all of it is covered on insurance or Medi-Cal or Medicaid or Medicare. So it won't cost you anything but a few minutes of your time to fill out a piece of paper, and you don't have to make an appointment. We will get you that flu shot right while you're in the store. So don't be too eager to get it. Don't worry about not being able to get a shot. There's supposed to be plenty of vaccine available. As we said last week, the one thing that will not be available is the live virus vaccine that's in an intranasal inhaler because it's not effective. And it wasn't effective last year. It wasn't effective this year. If you find it on the market, I would hesitate why anybody would buy it as a health practitioner or a clinician, because they know ahead of time it's not going to be effective. So after a year of having doubt about whether the effectiveness of it was good, last year they decided it was zero effective, and this year whoever manufactured it, if they did, it's zero effective this year. So a child is going to have to get an intramuscular shot, usually in the leg or the arm, depending on their age, from age 6 years old on. We continue to have people asking about prostates because they're confused. A PSA test is something that you take to find out whether or not you need to get treatment for prostate cancer. There's been a lot of information that those tests were not reliable. In 2009, the New England Journal of Medicine called the debate over prostate cancer that's a controversy that refuses to die. The U.S. undertaking called the prostate, lung, colorectal, and ovarian cancer screening trial that screened men for prostate cancer does not save lives. That has turned around, as you will notice in all kinds of things in the health industry today. What was primarily a reason to use the drug in the first place is now the reason not to use the drug. So we're going to tell you when we come back next week the results of some of these tests and why we consider it to be worthy of getting the PSA test, and why there's some documentation to support that. As time goes on, things change, and that's one of the things that have changed. We'd like to remind you that we will be giving the flu vaccine as soon as we get it available, and we'll let you know. We also want you to know that we're delivering prescriptions for you, as we have in the past. We do Kelseyville, Buckingham, the Rivieras, Lakeport, Nice, Lucerne, and Upper Lake, no cost to you. So we'd be more than happy to, if we get the information from you a day ahead of time, we'll set it up in our deliveries to deliver to you. If there's a charge, we will take the charge at the time in cash or a check, and we'd be more than happy to transfer those prescriptions for you. I'd like to remind you we're Northlake Medical Pharmacies with 2 locations at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192, or outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll welcome everybody back again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM, KXBX Lakeport.